Hi, I am Dr. Rahul Chandola. I am a senior cardiothoracic surgeon and heart-lung transplant specialist. I am working at the Institute of Heart-Lung Disease at Saket, New Delhi. So, in our country, there is a high burden of patients with end-stage heart and lung diseases. As a result, there are a lot of patients who are living with overt heart failure. Despite the advances in the medications to control heart failure, there are a number of patients, who are lying in the hospitals with, repeated hospital admissions for end-stage cardiac disease. These patients can be helped only with the heart transplant. Similarly, there are a lot of patients, who are suffering from interstitial lung diseases, COPD, and other end-stage lung diseases. These are the patients, who are not getting any help with the medical treatment only, or the medical treatment has exhausted, and these end-stage heart and lung disease patients can be helped with high-end solutions like heart transplant or lung transplant. Unfortunately, in the northern part of our country, the cadaver organ donation programs were not very active till a few years ago. But fortunately, over last couple of years, things have gradually improved, and now we have a good number of cadaver organ donations in the North India. As a result, the programs are getting concentrated around Delhi NCR. There are programs that are coming up with the solutions for end-stage heart and lung diseases. Things have rapidly taken a turn after the Prime Minister actually spoke about organ donation and the importance of it in Mann Ki Baat. As an example, you can see the number of cadaver organ donations that were happening around 2 years ago were like 1 to 2 every month till 2 years ago. But in last year, the things have rapidly improved, and this month we had around 10 to 12 organ donations in a month, which is a great leap forward, and that will help in building up the heart and lung transplant programs. So the biggest challenge is, in the patients who suffer from end-stage heart and lung diseases is the recognition and the awareness about the disease itself. So the awareness is quite dismal. Patients keep taking medications for forever, and when they present to the tertiary care hospital, where these facilities are available, at that time the things are already gone too far. These patients have got overt heart failure with involvement of the lungs as well. At that time, the heart transplant cannot be offered, unfortunately, and the things have gone too late. The pressures in the lungs have become so high, the PA pressures have gone so high that it becomes a contraindication for heart transplant by then. So the recognition of the disease early on is a major challenge. It also is a question about awareness of the physicians, and the doctors, the primary doctors that are treating these patients. Many a times patients are not ready to go to the tertiary hospitals to take the definitive treatment. As a result, when they present to these tertiary hospitals where these facilities are available, things are already too late. That's one of the challenges. Another challenge is because these transplant programs revolve around the concept of organ donation, cadaver organ donation. So the availability of the organs becomes a challenge. There are a limited number of donors. It's a problem worldwide, but in our country, especially in the north, that was a problem which was quite significant for a large number of population which is suffering from end-stage heart and lung diseases. The amount of organ donors which are available are very limited. In that scenario, making these organs available to each and every patient who suffers from end-stage heart and lung diseases becomes a real challenge. So, the heart and lungs, they're lying in the thorax, and they work as a unit. We can't see the heart and lungs as separate units. Unfortunately, most of the centers that we have in our country, they are either cardiac centers or lung centers, the pulmonology centers. The heart, lungs, they work in unison, they work together. If there is a problem in the heart, it gets reflected in the lungs. If the heart has got some disease, that leads to low functioning, it will get reflected in the lungs. The amount of blood that will be pumped through the heart will get decreased, and that will get accumulated in the lungs. The lungs will get congested. As a result, they will start behaving in a very different way. If the patient is seen by a pulmonologist who is a lung specialist, he will diagnose that the patient has got wheezes, has got some crackles, but where they are coming from, it doesn't know, right? So similarly, a patient who has got the lung problems, and problems are, especially the patients that we see, the end stage lung disease patients that we see often, they have got cardiac involvement. The right side of the heart is diseased. Actually, a problem in one organ gets reflected in another organ. So they have to be seen as a unit together. And there always is a need, therefore, to have a center that is capable of catering to both heart and lungs. We see the heart and lungs as a unit together. Can't see heart as a separate unit from the lungs. If the heart is diseased, it will get reflected in the lungs. The lungs will have a problem, in varying proportions. If the lungs have got a disease, especially the end stage lung diseases that we see, the heart invariably is involved. So they work as a unit. Therefore, there is a need to have a center that caters to the entire subset of heart and lung diseases, where the treatment is available to see that as a unit and treat that as a unit. Institute of Heart Lung Disease is one such center, that we are aiming to provide solution to this particular problem. This institute has got the specialists, who are very highly trained in their respective fields. As an example, there are transplant pulmonologists, there are transplant cardiologists, transplant trained cardiothoracic surgeons, and a very dedicated cardiopulmonary rehabilitation team, which is capable of dealing with these debilitated and very complicated set of patients. So, Institute of Heart Lung Disease is quite unique because not only it provides the clinical solution to patients with the heart and lung diseases, it also is involved with research. So we have come up with a device, which is a phenomenal device for heart failure, and this device actually is able to pump up to 3.5 to 4 liters per minute of blood to the entire circulation. It's a miniature ventricular assist device that can be put through the peripheral arteries, and that goes inside the heart and is able to pump blood out of the heart into the circulation. It helps the failing heart, in cardiogenic shock, and also it bails out difficult PTCAs, difficult stenting procedures. IHLD, Institute of Heart Lung Disease, has got a patented device in its name, and it's in the process of development. In probably 2 years' time, IHLD will come up with this device, and the device has got potential to revolutionize the treatment of patients with heart failure. It also takes pride in being one of the foremost organizations that has got a very capable cardiopulmonary rehabilitation program, one and only program in the north, that is able to provide AI-based solution to the patients suffering from various kind of debilitating illnesses. The physiotherapy that is being provided, the rehabilitation program that incorporates these AI-based algorithms, is quite advanced in every possible way.